Hello, my name's Hattie and I'm the Woodland Creation and Tree Planting Project Manager, and I work for the Centre for Sustainable Healthcare on the NHS Forest project. Today I'm going to be talking about tree planting across the NHS estate and why healthcare green space matters. So I'm going to cover what is the NHS Forest project and a bit about our history working across the NHS estate and the breadth of what we do. I'll be looking through some case studies of healthcare sites which demonstrate green space best practice and in the ways in which they've been planting trees for creative purposes. And then I'll go through about our tree planting, our offer this season, outside our season, and how to apply. So what is the NHS Forest project? It's a green space. It's a project run by the Green Space team at the Centre for Sustainable Healthcare, and the NHS Forest is a national good practice network for NHS sites working to improve the social and ecological value of their green spaces. And this can mean many things. It can be tree planting, horticulture projects, orchard creation, meadows, therapeutic gardens, art trails, and much more. And there's an interactive map on our website to go and look at all those different projects. We started in 2009, and although tree planting was the initial kind of motivation, we're much broader than that. And we have nature recovery ranges. We run training and webinars, and we input into research and policy work. So why plant trees on healthcare sites? There's direct healthcare benefits, which I'll go through on the next slide. There's also indirect health benefits. So these are kind of through the ecosystem services that trees provide, and these can be things like cleaner air that they produce, the cooling effects that they have through producing shade, and like flood prevention that they support as well. And these types of things were key motivations for people who had planted trees last season and was mentioned frequently in our feedback form. There's also financial benefits of having woodlands on the site, and a forestry research report published at the beginning of 2024 estimated that the annual monetary flows of woodlands on 4 NHS sites was around £80,000, and this was calculated based on those ecosystem services that these woodlands provided, and also included the carbon sequestration value of these woodlands. It didn't even look at the potential cost savings that the woodlands provided for through like kind of more indirect ways like shorter hospital stays and improved staff wellbeing. So the benefits could actually be much broader than we imagine. Lastly, the Space to Breathe report found that staff who spent more time in nature at work reported significantly higher levels of wellbeing than those who didn't. And also in this same report, almost 50% of staff said an attractive green space was important to them in considering where to work. So there could be important recruitment and retention implications there. Next slide. So a bit more about the direct health benefits. So, I mean, there's loads of research around why being outside in green space is really good for your health. It can help with vitamin D synthesis, which can help with your circadian rhythm as well, which is fundamental for sleep. Phytoncides, which release from trees, are especially good for the immune system and stress reduction. And research has indicated that even simple and brief interactions with nature can produce really good increases in cognitive control. And there's also studies into like outdoor walks, reducing clinical depression by 30% compared to similar walks taken in indoor situations. And then reducing tension, looking at a landscape and enjoying fractal designs is really good for our mind, and the human mind loves to engage with the visual complexity of nature. So this was the Space to Breathe report, and these were kind of the findings of green space activities which were described by interviewees. So it's nice to see the different types of things happening outside. So people take their lunch outside, they take the patients outside, they go for a brief walk, they take part in organised activities such as qigong, and they hold outside meetings, which are really brilliant. So these are a few more of our reports that we've been involved in, if you are interested in learning more. So now I'm going to go into the case studies. There's about 4, and they cover a kind of range of different sites. So the first one is Pinderfields. Pinderfields took about 4,000 trees from us last season, and they have a really brilliant way of managing their site that's very biodiversity focused. So they've made some really drastic ways in the way that they've changed their landscape management, and they've stopped mowing their estate, and they've let about 10 acres of grass go to meadows. And with no seeding whatsoever, 50 species of wildflowers have been recorded, and that doesn't include grasses and sedges. And they leave these parcels of land to grow for the whole season until late September, which allows insects to complete their full life cycle. And they've continued this practice year on year. They also have loads of bird boxes around the site and bat boxes, and they have tawny owl and swift boxes. The reasons that they have been planting trees with us is because they have a lot of laurel and snowberry, which are kind of more ornamental species, which are previously planted across the estate, and they don't actually have a whole lot of biodiversity value. So they've been selectively removing some of these species and replacing them with trees and hedges that do support local diversity. Next is Langdon Hospital, which is a secure mental health site that uses tree planting to support biodiversity, and also uses it for occupational therapy, which blends environmental conservation with patient wellbeing. They started restoring a Devon hedge as part of their patient care pathway, and during this project they discovered a veteran orchard which had been forgotten about and completely overgrown. They've reinstated this, and it's estimated to be over 40 years old and has lots of veteran features which are really great for biodiversity. They have lots of great mammals on site, and they've got a wildlife camera where they've spotted a hazeldawn mouse and badgers. They've also put dead hedges around the site, which you can see in that photograph, which are really good for nesting birds. And they've included a buzzard trail, which is like a green walking route around the site, which is really good for spotting buzzards and other birds, which has been really useful for some patients to interact with their environment. And there's one patient who the occupational therapist I talked to commented on has really come out of his shell and tells everyone about the nature that he spots on his daily walk on the buzzard trail. So this is a bit more of an urban case study. This is Abbeyfields Medical Centre, which is in Essex, in Colchester. So this site took 30 trees from us last season, and it's a very it's a site that's lacking a lot of green space. So these trees were kind of like rowans and silver birches, which are quite good urban trees, which are kind of dotted around the site. But this is a great example of using green space to the optimum value, and it's really been put into good use for the local community. So they work with this rural green skills charity called Abberton Rural Training that provide this NVQ level 2 in horticulture within this green space. So they formed this partnership, and they've worked with patients and anyone who wants to get this qualification in this green space, and made it much more inviting and much more productive. They grow vegetables and herbs now. They've got a little orchard at the back. They've got 2 different tea sheds, so staff and patients come out from the medical centre as well and come use this green space as well as their participants of their course. So this course is often referred to people through green social prescribing from the medical centre. So that's also a really great way that healthcare professionals can see the benefit of the green prescription within their site. This is my last case study, I believe. So this is Tickfield Road Hospital in Doncaster. So they did some planting with us last season, I think 4,000-ish or 3,000 trees dotted around the site. A lot of it was done for like screening. So this is kind of a hedge that they've put just to create some kind of boundary around those buildings in the background. They also kind of broke up some lawns by doing some planting. This is behind a maternity unit, I believe. And then after doing some digging, I realised that we'd actually planted trees with them 15 years ago in 2009. And here you can, if you look at where the security camera on the pole is in relation to the tree line, you can see how much these trees have grown in 15 years. And it just shows what a difference you can make. They then went on to receive further funding from us to install a green gym and to install a walkway, a wheelchair accessible walkway through their ancient woodland in order to kind of expand its access. So the trees that they planted back in 2009 were really heavily mulched, and they had a bit of watering the first and second year, but they were kind of left to it, and they had a really exceptional level of success, around 90%. And they applied a bit of wood chip for the first few seasons as well, but other than that, the kind of maintenance was really minimal. In 2022, 13 years later, the site worked with the conservation volunteers to come and do a bit of thinning because the trees had got so big, and there was some sycamore which had self-seeded underneath. So the conservation volunteers worked with local volunteers to do a few days maintenance, and they thinned some of the species and took out some of the dead wood and created habitat piles. And they reserved the majority of the trees, but they picked out particular specimens which will be especially good for biodiversity, like a few oaks and that. Also, the tree guards were taken off at this point if they hadn't already been. So yeah, 15 years later, this is a really impressive semi-mature woodland, and it's thriving. And this is the wheelchair accessible path that I mentioned. They run forest school, I think, in some pockets of the woodland. So yeah, as I said, they became one of our first big partners and created that green gym and installed the paths, which all kind of promote health and well-being. And it's become a much more publicly accessible space. So St Catherine's, which is was like the stately home which all this land was around, was a mental institution which was extremely stigmatized. And so by increasing like public access, and this is now a very popular path with local dog walkers, it's really changed the perception of the site, and people really appreciate it, and it's become much more integrated into the wider community. So it's really nice to see that like this woodland planting that we helped them do then became this kind of more like broad project that enveloped the whole kind of community as well. This is St Catherine's, which I mentioned, and the kind of woodland is much bigger than what's on the map, but it kind of goes around the whole site. And Flourish took on the market garden and some of the buildings of St Catherine's, and they've become this community interest company, which is part of the same NHS Foundation Trust. But they deliver green social prescribing through like gardening sessions and green skills training, and they have a huge impact. For example, last year, 165 people attended one of their sessions, like some of their sessions over a week. Here are some photographs of the types of work that they do. They integrate, and they also, like, these are espalier trees. The top right-hand corner is a picture of apple and pear trees, and the kind of tree planting that they've done with us has been integrated into their upskilling program, their green skills program, and they use their produce such as apples, mulberries, walnuts, figs to sell within their cafe, the community cafe, or make into produce with the different groups that they work with. So lastly, I'm just going to go over our tree offer. So we've only got 4 more months. Our funding in its current form finishes in March 2025. So make sure you put an expression of interest in as soon as you can. So who qualifies for trees? The majority of our funding is for the NHS estate, but if you are based at a GP surgery or on another kind of healthcare site that the NHS provides services at, which isn't necessarily NHS owned, you can qualify through other grants that we have. So put an expression of interest in anyway. And the same goes for sites in Scotland, Wales, and Northern Ireland. We are a bit more limited in that we have funding for these countries through tree sponsorship, but regardless, put an expression of interest in anyway. So the form is what you can see on the right. It takes about 5 minutes to fill in, and that just lets us know that you're interested in trees, and it helps us communicate with our tree nursery. There's a second stage of the form where you give us a screenshot of a map, photographs of the site or where the trees are going, and a bit more information so that we can communicate where the trees have been planted to our funder. We also have a matchmaking service, so this is just a page on our website, and we created it as a response to the feedback for sites around lack of capacity to maintain green spaces. So basically, sites can register on our website if they require green space volunteers, and then volunteers can sign up to receive notifications from their region, and they'll automatically get pinged event reminders if they are within your location. This can be for one-off events, it can be for regular kind of green space events, and it doesn't have to be tree planting related. It can be tree maintenance, it can be general green space work. And then lastly, if you want to work with our corporate partners, RSK, they're based all across the UK. They've got offices everywhere, and they're very willing to bring out a group of kind of 10-ish volunteers to come support you with any kind of green space related work. Right, lastly, trees we've got available. We've got a wide range of bundles, and these I'll go into these in the next slide. We support woodland creation, and that's for sites who want to plant more than 300 trees. And we have fruit trees. So the bundles, we've got a wide range of choice, and they kind of range in size from 10 trees to up to like 240 trees. You can choose a mixture of different bundles, or you can choose multiple bundles, but they're all designed to kind of suit different requirements of sites. And if you have a look on our website to see what's in them, each bundle has like a minimum of 3 different tree species in, actually apart from the extra small bundle, which is just 10 trees of one species. For some context, this is how the trees arrive in the picture on the left. So that's they come in the post, but delivered by DPD, and they come with their root ball. So they have a bit of soil that they grew in, which is comes with the tree, and this is really good for their success rate. They also come with some bamboo canes and some spiral guards which wrap around the tree and the cane. And this year we're also supplying some wool mulch mats, which just go at the base of the tree, and they're just a square bit of fabric with a slit in, and they just wrap around the tree, and that's just to prevent it from having competition with weeds, and the wool matting will eventually biodegrade. So woodland creation, the threshold is 300 trees or above. If you want more than 300 trees, you can choose from like a wider species list if you want, and that's from the UCO list, which is the England Woodland Creation Offer list. and you can have a bit more of a bespoke order. Also, the majority of our trees are 1-year-old whips, which are what you can see in this photograph. But if you have a larger order, you can actually have a larger allocation of bigger trees. So up to 100% of the trees can be 2 to 3-year-old kind of trees, which are feathered maidens, which have a bit more impact on the site. Lastly, we've got fruit trees. These are also kind of feathered maidens, so 2-ish years old, about 1.5 meters to 2 meters, and you can choose the rootstock that you require and species based on what you want from an orchard, really. We encourage planting in an orchard formation with a minimum of like 5 trees planted together, and the minimum order is 10 trees. So orchards are really brilliant for biodiversity. They're a priority site for biodiversity. They can create a good space for community events. You can put a picnic bench underneath and organise events around an orchard. So, Apple Day, or you can do a bio blitz, or you can go and look at the blossom in the spring. And then obviously they have the added benefit of having a bit of fruit production as well. That's everything from me. Please email me if you have any questions, or if you want to apply for trees. Or have any questions about that, let me know. Great, thank you very much.